Becoming an aesthetic nurse is a rewarding and fulfilling career choice for those who are passionate about helping others look and feel their best. It requires a unique combination of medical knowledge, artistic skill, and compassion for patients. If you are interested in pursuing a career as an aesthetic nurse, here's a step-by-step guide to help you achieve your goals. Step 1. Obtain a nursing degree. The first step to becoming an aesthetic nurse is to obtain a nursing degree. This typically involves completing a Bachelor of Science in Nursing (BSN) program, which typically takes 4 years to complete. During your nursing education, you will learn the fundamentals of nursing practice, including anatomy, physiology, pharmacology, and patient care. Step 2. Gain clinical experience. After completing your nursing degree, you will need to gain clinical experience as a registered nurse, RN. This typically involves working in a hospital, clinic, or other healthcare setting, where you will care for patients, administer medications, and assist with medical procedures. Clinical experience is essential for developing the skills and knowledge necessary to become an aesthetic nurse. Step 3. Obtain certification as a nurse practitioner. To become an aesthetic nurse, you will need to obtain certification as a nurse practitioner, NP. This typically involves completing a Master of Science in Nursing, MSN, program, which typically takes 2 to 3 years to complete. During your NP education, you will learn advanced nursing skills, including diagnosing and treating medical conditions, prescribing medications, and providing patient education. Step 4. Specialize in aesthetic nursing. Once you have obtained certification as a nurse practitioner, you can begin to specialize in aesthetic nursing. This typically involves completing additional training and certification in aesthetic procedures, such as Botox injections, dermal fillers, laser treatments, and chemical peels. Many aesthetic nurses also pursue additional certifications in areas such as dermatology, plastic surgery, or cosmetic nursing. Step 5. Gain experience in aesthetic nursing. After completing your training in aesthetic nursing, you will need to gain experience in the field. This typically involves working in a medical spa, dermatology clinic, plastic surgery practice, or other aesthetic setting, where you will perform a variety of aesthetic procedures under the supervision of a licensed healthcare provider. Gaining experience in aesthetic nursing is essential for developing the skills and confidence necessary to succeed in the field. Step 6. Build a professional network. As you gain experience in aesthetic nursing, it is important to build a professional network of colleagues, mentors, and industry contacts. Networking can help you learn about job opportunities, stay current on industry trends, and connect with other professionals in the field. Joining professional organizations, attending conferences, and participating in online forums are all great ways to build your professional network. Step 7. Stay current on industry trends. Aesthetic nursing is a rapidly evolving field, with new technologies, treatments, and techniques constantly being developed. To succeed as an aesthetic nurse, it is important to stay current on industry trends and advancements. This may involve attending continuing education courses, reading industry publications, and participating in professional development activities. Staying current on industry trends will help you provide the best possible care for your patients and stay competitive in the field. Step 8. Obtain certification as an aesthetic nurse. To further demonstrate your expertise in aesthetic nursing, you may choose to obtain certification as an aesthetic nurse. There are several organizations that offer certification programs for aesthetic nurses, which typically involve passing an exam and meeting certain education and experience requirements. Becoming certified as an aesthetic nurse can help you stand out in the field and demonstrate your commitment to excellence in patient care. Step 9. Pursue advanced training and specializations. As you progress in your career as an aesthetic nurse, you may choose to pursue advanced training and specializations in specific areas of aesthetic nursing. This could involve becoming certified in advanced aesthetic procedures, such as laser resurfacing, microneedling, or body contouring. Specializing in a specific area of aesthetic nursing can help you attract more patients, expand your practice, and advance your career. Step 10. Maintain licensure and certification. Finally, as an aesthetic nurse, it is important to maintain your licensure and certification to practice. This typically involves completing continuing education requirements, renewing your nursing license, and staying current on industry regulations and standards of practice. By maintaining your licensure and certification, you can continue to provide safe and effective care for your patients and uphold the highest standards of professionalism in the field. In conclusion, becoming an aesthetic nurse is a challenging but rewarding journey that requires dedication, education, and experience. By following this step-by-step guide, you can achieve your goal of becoming an aesthetic nurse and make a positive impact on the lives of your patients. Whether you are just starting your nursing career or looking to specialize in aesthetic nursing, the opportunities in this field are endless. With hard work, determination, and a passion for helping others, you can succeed as an aesthetic nurse and make a difference in the world of aesthetics.